Welcome back to Cheddar, everyone. The largest public transportation agency in North America, the Metropolitan Transportation Authority, known in your hood as the MTA. It has seen its finances implode due to the coronavirus pandemic and is set to run out of federal funding in July, which starts tomorrow. Joining us now is Pat Foye, Chairman and CEO of the MTA. Chairman Foye, thank you so much for taking the time here with us today. First of all, you were diagnosed with the coronavirus yourself a few months ago. I do want to check in and see how you're feeling.
Brad, first, thanks for having me. I had a very mild case, was diagnosed in March, was home quarantined for a couple of weeks, didn't miss a day of work. I was very fortunate. I tested negative in April and I've donated plasma. And hopefully that'll help some transit worker or someone else who's suffering from the virus.
Certainly. All right. Well, we're glad to hear that you are doing better. And right now, when we think about the broader situation and states, local economies looking to reopen, some of them putting those plans on pause, but it also comes down to transportation in cities like New York City. So what is the MTA? Spell out exactly what the plan would look like for us as we do start to inch back towards a full reopening, even though we are far off of that.
Well, look, happily in New York City and New York State, under Governor Cuomo's leadership, we've been able to flatten the curve and to stop the spread of the virus. And that's an incredible achievement. Mass transit, the MTA is playing and will play a critical role in the recovery of the New York City and regional economy. We're about a $17 billion organization. Half of that comes from fare and toll revenue from our customers, and the other half from a dedicated package of taxes and subsidies that have been passed into law by the state legislature over the last couple of decades. Both of those are affected dramatically and precipitously by the pandemic. At one point, we were down to about 95% decline on subways, similar declines on buses, Metro North and Long Island Railroad. Latest data is we're carrying about 20% of our pre-pandemic level customers on subways, approximately. Over 50% on buses, although we're not collecting a lot of revenue because of a public health protection rear door boarding that we put in place to minimize contact between customers and bus operators, and even greater declines in ridership on the Long Island Railroad and Metro North. The precipitous decline in ridership, and even though it's coming back, has exacted a huge toll on our fare and toll revenue.
Okay, and
the same thing is happening. Please.
Well, no, what you were breaking down, and I think you were about to go into this as well, because of the fare and toll revenue that you mentioned and what it accounts for the operational procedures for the MTA, what percentage would that need to get back up to for you to be able to get back to adding more lines to schedules or adding more, not routes, but adding more frequency to some of the existing lines that are on the network?
So happily on subways, Brad, we're running 100% of pre-pandemic service, and basically the equivalent on our buses, less service on Metro North and Long Island Railroad because they have not recovered to the same extent that subways and buses have. So it's not a question of putting service on subways and buses. We're running full service. We have the capacity, obviously, on subways and buses to carry far more riders. That would be a positive thing for the regional economy, for job creation and job retention, and also for our revenues. But we hired the international consulting firm McKinsey. Their estimate of the loss in revenues in 2020 alone is nearly $8 billion. 7.75 billion was McKinsey's estimate. We received $3.8 billion from the federal government in the first round of CARES funding, thanks to Speaker Pelosi, the New York congressional delegation, Senator Schumer, for that money. In July, we'll have covered our expenses through July. We'll get the last installment of CARES funding in sometime in August. And I have to say the FTA part of US DOT has done a good job of facilitating that payment. We're asking for an additional $3.9 billion to get us through the rest of the year. And that funding is really critical to our finances and our ability to continue to operate.
How confident are you that the $3.9 billion that you've applied for in additional aid will materialize?
Well, look, we've got strong support from Senator Schumer, from Chair Anita Lowy, from the New York congressional delegation, but obviously these are uncertain times in Washington, to say the least. So it is really critical that we get that financing and continue to operate and play the important role we're playing in New York's recovery.
You do have some individual consumers, of course, of the MTA that are going to say to themselves, all right, in the near term, I'm going to use other forms of micromobility. We know that bikes have essentially sold out in the city. We know that some of the micromobility efforts of even small companies, startups like Revel, or even like the city bikes, as we've seen, there have been more of a focus for end users and travelers within the city to use micromobility. And so as you are seeing that shift, where does the MTA come into play in the future? What investments might it make on a micromobility front, even more so in the future?
Well, look, the existence of micro mobility is a huge positive. I will, however, point out that on an average weekday prior to the pandemic, we carried 5.5 million customers on subways and over 2 million on buses, 2.1 million average day. Obviously, that's not those numbers. Those 7.6 million customers on a pre-pandemic weekday. Those folks, as they return, are going to, in great numbers, look to subways and buses. At this point, we're carrying well over 1 million customers on subways and buses every day. Micro mobility options will play an important role. So will, frankly, walking to work where that's an option. But for lots of customers, especially lots of low-income customers who live in the so-called outer boroughs, the way they will get to their jobs in Manhattan, Brooklyn, and Queens will involve the subways or buses.
Okay, Pat, while we have you, I'm sorry, we got to go a little rapid fire with these last two questions. But first and foremost,
Sure.
How confident is the MTA that it can get more people to ride the subway with fears of the spread of COVID, as long as there is no vaccine, the spread in small enclosed spaces? And what will the cleaning routines look like in order to quell some of those fears?
So I'll give you a rapid fire answer. Riding subways and buses is safe. Scientific evidence around the world. Tokyo, Berlin, Shanghai, other cities have recovered, have gotten close to pre-pandemic levels on mass transit without a spike. We're disinfecting every rail car at least a couple of times a day, multiple times every station, twice a day. We're following the advice of public health officials. The system is safe. Everybody here at the MTA rides it every day.
And then just lastly, while we have you, what have you learned from this pandemic? And then, how has it changed public transportation, not just in New York, but in other major metropolitan areas?
Well, look, New York and large cities are built on density. We're in the mass transit business with the emphasis on mass and transit. Obviously, the pandemic throws those assumptions into stark relief. It's clear that the MTA is playing and will play a critical role in the recovery of New York's economy. We're doing that now. Our 70,000 member workforce has done an unbelievable job during the pandemic. They're heroes, moving heroes, and they will continue to get the job done. We're doing everything we can, not to clean, but to disinfect every subway car, every bus, and every station.
Pat Foye, Chairman and CEO of the MTA. Pat, we appreciate the time here today on Cheddar. Thanks so much.